Okay. Hey, so I'm back. Um, so I'm walking into an office, and to say I meet with somebody who has a perspective of Freud or Erickson, and they would sit with me and ask me what I think is wrong, after the nice, pleasantries of hi, what's your name? And I'm here today. I would say I'm having difficulty with relationships. I don't feel like I'm really making them work. I don't have any very strong bonds with friends or colleagues at work, or even in my own family household. So I'm here, and they would talk to the psychiatrist or psychologist, social worker or counselor, and with that approach, let's say they explored certain things. Erickson has his stages, so does Freud. Maybe I'm stuck in one of those stages. Maybe I'm immature. Are you immature? Because maybe you're stuck in the phallic stage. And I'm like, no, no, I'm pretty mature. Okay, so it's not that. Um, what are your expectations, do you think? Are you supposed to have strong bonds with people? Where does this come from? So maybe they try to manage like how I am with my super ego and my id, my desire to have certain things fulfilled versus expectations, and maybe my ego isn't managing that well. But let's say that's not really working out either. That's not really the problem. And they ask me more about childhood, right? So, how's your childhood? Well, I don't remember having a strong connection with my mom. Oh, tell me more about that. Well, when I was a child, she was working full time, so was my dad. My dad was going to night school, in fact, as well as working for the IRS, and he was going to school to become a lawyer. My mom worked for a law firm, and she worked 12-hour days. So I was left with a babysitter almost, for the first 4 or 5 years of my life. And I didn't really have a strong bond with my babysitter either. So here I'm thinking that, and again, they get deeper into it, and they diagnose me and they say I have a unsecure attachment. And so when people have an unsecure attachment, the treatment would normally be to try to bring that to the conscious, right? To make them more aware of this problem. And maybe they can work it out through therapy, just talking with a person, one on one, every other week or something. So I can better understand that the relationship I had with my caregiver from the early ages has an effect on my relationship with everyone else. And I didn't really have a secure attachment with my primary caregiver. And so, therefore, after, it's been very difficult. I've been independent and not really forming these close connections. And they're okay. There you go. There's your treatment. Okay. Oh, okay. So that might take a number of months to a year or two, but it works out. And again, is this a very dangerous disorder? No, it's not dangerous. It's not totally dysfunctional. I'd have to tell them more. Maybe we don't talk, and maybe that is a little bit dysfunctional, and that might create problems in the family and dynamics and so on. So that's why I'm here and talking about it. Well, let's look on to the second approach, and let's say someone like Watson or Skinner. Okay, maybe Bandura. It depends. But Watson and Skinner are behaviorists, right? So they're asking me, so what's the problem? What do you do? What's your behaviors? Let's analyze your behaviors. What is it that you do? Well, I don't talk very much to the people around me. We pretty much ignore each other. Okay, that's the type of behavior. We can observe that, right? Well, they all seem to go on their phones and spend time on their devices. I don't tend to do that. I don't have a device that I use. But I see them doing it, and sometimes I feel like I should get my phone out too. And we end up not talking. This is like with the family. So this is what the family dynamic is like. So they start to kind of think through, and they're like, okay, is this based on classical or operant conditioning? And they probably might opt into the operant conditioning. That's more the rewards, positive reinforcement, stuff like that. And they'll be asking about associations and probably trying to analyze my associations with being alone. Do I have negative associations with being alone? No, I've accomplished a lot working by myself. So they probably run to the conclusion, well, maybe there's not that many problems here, and you're associating independent work with good positive things. Fortunately, it worked out for you, that you didn't feel you had to deviate from that norm to working with others to accomplish what you need to do. So you did receive positive reinforcement and reinforced a behavior that pretty much keeps you to yourself. They won't get into the bonding or how I think about it. It's just like, let's look at your behavior. Well, let's say my behavior is like, I want to make friends, I want to be interpersonal, I want to interact more. They're okay. Well, let's model that for you then. And they may call in someone like Bandura, who does believe in modeling behavior. So Bandura then sits with me and says, okay, well, let's talk about what a healthy, positive relationship sounds like when you're talking with somebody, okay? And then maybe we do some little skits and interactive situations. What do you say in this situation? He would model it so that I could develop those behavioral habits, okay? And so maybe that would be a very positive thing. I'm like, okay, well, this is good, and me practice it in the real world. Okay, moving on. Okay, that was fine. The behaviorists have a certain other way of thinking. So imagine now I see a humanist like Maslow, right, or Carl Rogers, and it's funny. I might walk in and they're like, "Okay, what seems to be the problem? Do you think?" And I described it, the same problem, and they're like, "Okay, why does it have to be a problem?" That may just be how you are, and I see you as a person, a client, not a patient. This is not a disorder. Okay, I mean, you haven't described anything that's dangerous as putting anyone else's life in danger. So this may just be a part of your personality, and it's something that you should embrace. And they model for me unconditional positive regard for me, for who I am, and I feel like so affirmed. I'm like, oh, I like these people. I keep coming and they make me feel good. Why? Because they're basically accepting me for who I am. They're like, okay, it's okay that you don't like to talk all the time. It's okay that you're reticent. Okay. Great. There's nothing really wrong here unless you think it's wrong. Do you think anything's wrong here that you want to fix? And maybe I think, well, maybe. I mean, that's why I'm here. Maybe there's a lack of congruence between your self concept of who you are in reality. Let's look at your relationships, and maybe we find out that maybe in my mind, I'm making it out to be worse than it is. And they say, hey, you seem to have very positive relationships. You're loved and supported. They're always there with you in the same room. Just because you talk doesn't mean you're not loved or supported. And I'm like, oh, well, I don't know. My self-esteem tells me that I'm not loved. And I'm like, well, no, you are loved. And, maybe something just doesn't allow you to achieve this sense of belonging. Let's look down Maslow's hierarchy of needs. Maybe it's a sense of not feeling safe. Yeah, maybe that's what it is. I don't feel like being vulnerable and sharing things about me because I'm afraid of rejection. Like, well, if you're in that fear mode, then you're never going to create this bond relationship with others, because that's what relationships are, is being vulnerable and being accepted for who you are. You just got to learn to befriend and invest in relationships. And I'm like, wow, all right. So, and in that relationship between the person and the therapist, they accept me, so I start to feel more comfortable sharing, and maybe that will help me. Okay, well, let's say I go to a cognitive psychologist, and they sit with me, they hear my problems, they're like, so tell me more about how you think, so it's really focused on my way of thinking, right? And let's say they come to the conclusion in their diagnosis, you display some dysfunctional, maladaptive thoughts. We uncover that you're not feeling adequate about yourself when we come right down to it, that you're not good enough or lovable. And this is your voice in your head, and this is how you think. And then these insecurities inhibit close, trusting relationships. So all we need to really do is replace those maladaptive thought processes and voices in your head with more positive ones. Someone that says you are lovable. And they're like, oh, is this a mantra? Do I repeat that to myself? Sometimes you do, yeah. Sometimes you must tell yourself and read this poem or read this book, and we wake up in the morning and say, I am deserving of love and trust. I'm a good person. And then you'll feel better about yourself. You'll expect more from others, instead of expecting less. All right, so cognitive psychology, thank you. So if I went into a biological person, a biological psychologist, you might say, okay, well, let's put you under, let's kind of see what's your diet like. Let's do some scans maybe. Like, what are you having trouble with specifically? Maybe they'll take some blood, right? They'll check my hormonal levels. Want to learn about my genetics, my background, my family history. And let's say they just dig, right? Because they're going to be digging on stuff like that. and it's just let's see that they find some stuff out, and then this would be surprising both to me and everyone. They might find like I'm on the spectrum. I'm like, oh, what is that? And they're explaining, well, yeah, some people might find themselves on a spectrum of autism. And I'm like, wow, how would I know that, right? No, well, you probably didn't know that. Now we're just diagnosing you right now. And based on your behaviors, like, I told you a joke and you didn't laugh. And like, I don't understand. What do you mean? You told me a joke? Like, yeah, that's sometimes a sign. I said a joke and you didn't pick up on the cues. Here, I'm smiling right now. When I smile, what do you think? I don't know. Like, I don't know. I don't even, my brain doesn't translate that you are smiling. So I'm not picking up on these cues. They're like, that might be the problem with interpersonal relationships. If you don't pick up on cues, which is a basic communication between people, reading people's body language or facial expression is really helpful with the emotional intelligence of connecting with people. So like, well, this is a big deal that we found out. I'm like, wow, I couldn't believe it. So that might explain a lot, right? So anyway, that would be the biological perspective, right? They might suggest some medication. That's usually the treatment is like, oh, we should prescribe this for that, this kind of medicine. Take some of this, see what happens to your situation. Now with autism, I really don't know what the treatment would be, because sometimes it's just like that's what it is. And now we know, but you're more aware of it, and you got to tell people like, sorry, I'm not picking up on the cues. So I just can't. I'm on the spectrum. That's to let people know. Anyway, moving on to evolutionary psychology. So it's interesting. They might look at me like, well, I don't know. You're a pretty good looking guy. That should weigh in your favor, and you're very tall. You look athletic, right? Usually those are genetic qualities that are passed down that people are attracted to. So I don't understand that you're having interpersonal problems. No, but no, I mean, I am married. Oh, you're married. You have 3 kids. What's the problem already? You've already passed on your genetic code to 3 children. You have progeny. So what's the problem? Maybe there is no problem, right? It's okay to have a loner gene. It's maybe not a bad thing. It looks like you found a way to not be alone or lonely, right? Some people might be alone and they can change certain qualities about themselves that are hereditary. So, obviously the goal of evolutionary psychology is to pass on traits down to your progeny. And, if I have 3 kids, they're like, well, why you're here. It looks like unless networking is a problem, you have a successful job. Again, we don't see a disorder here. Okay, it's like, again, and that's also one of the key themes in here. Not every problem is a disorder, okay, per se. I mean, is it dangerous? Is it dysfunctional? Is it distressing? Okay, so those are sometimes the criteria, because it depends on our social cultural situation. That's the next psychologist, and they look at the situation. They look at everything. Oh, okay, you're Mexican, you're Latino, you live in the United States. I mean, sure, the Latino thing is a very family-oriented culture, so you don't feel like that's part of your identity. And I might say, no, not really. I feel like I would prefer not to be around my family. I prefer to be alone, maybe with my own family or alone. And they just start to ask questions. Well, we live in a culture that really promotes individualism, so it's not a bad thing. I mean, you probably have assimilated and being alone, and people are alone in many cases, and there's some normal behaviors that's alone, where you're alone, like gaming or being homeschooled, choosing not to participate. It's not a negative thing. So, it's just part of, the culture you grow up in. And they might ask about my family too, because were your parents permissive, authoritarian? Like, they can be either or. So they didn't want me interacting with certain people. Well, there you go. Their culture didn't allow you to, interact with the kids around the block, or certain kids who didn't go to the same church or something. And that can make a difference with your values. Okay, I learned a lot, right? But notice, all 7 perspectives are just so different, and it makes quite a difference. Perspectives do matter when you're looking at disorders and trying to figure out basically what's the problem, and diagnosing it. And again, this book here will talk a lot about all the different possible disorders that people might have, and it does have treatments in here as well. And the treatments vary. One of the more eclectic approaches is just combining the three: bio, psycho, social. That's the most popular one. So bio, because they're gonna obviously think the brain, hormones, body stuff, neurotransmitters. Obviously, that's gonna affect your situation, genetics. Okay, there's something called the diathesis stress model too, where yes, you're genetically prone to certain things, but it may not click until you've exposed to a trauma or a stressor in the environment. So that perspective considers nature and nurture together, but that certain problems or disorders don't sometimes happen unless there's a genetic disposition and a stressful, traumatic situation that impacts and pushes that person to a certain brink, where they're faced with a certain conflict or a problem that they can't resolve. Maybe then they need some help. They need some therapy. Maybe they need medication. And that before it spirals, it gets worse, right? Because one problem can lead to other problems and so forth. And sometimes we don't know why, for example, people who are homeless, were they homeless because of disorders and problems that they had with their personality or interpersonal relationships? Or was it because now that they are homeless, that stress brought on these other things in their lives that just made it even worse? So again, it's like the chicken or the egg. Sometimes we don't know what came first, and again, without someone really talking to you, asking you a bunch of questions and trying to learn about your history, not just your medical history, but your cultural, social interactions, your education, how you were raised, all that stuff becomes part of who you are and who you're continuing to be. And that's why all these different approaches will ask you so many different questions to find out and get into it, to figure it all out. And so I look forward to this unit with you, because we haven't gotten into the other specific disorders, but starting on Thursday, we will do just that. And it should be very interesting. And I look forward to seeing you guys next time live. Bye.